Aloha everyone, and thank you for joining the COVID-19 Public Health Action Webinar, Community Relief and Resources for Honolulu. My name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Before we get started, we have some Zoom housekeeping to go over. For all questions, please utilize the chat box or questions and answers box located at the bottom of your screen. We are not offering any continuing education credits through this webinar series. And lastly, all webinars are being recorded and will be available on the Hawaii Public Health Training Hui's YouTube channel. I will be serving as your moderator for today, and it's my honor to introduce you to our guest speakers. Our first speaker today is Patrick Branco. Patrick recently joined the City and County's Department of Community Services as a Disaster Preparedness Planner 6. He completed his studies at Hawaii Pacific University and Johns Hopkins University in International Relations. Before joining the city, he served as a U.S. diplomat for 7 years with the Department of State in Colombia, Pakistan, and Venezuela. Our second speaker today is Lisa Kimura. Lisa is the Vice President of Community Impact at Aloha United Way, overseeing the statewide 211 helpline and working to develop systems-level change within the health and human services sector. Lisa serves a leading role coordinating Aloha United Way's asset-limited, income-constrained, educated initiative to reduce financial hardship in Hawaii, bringing together nonprofit agencies, coalitions, and government partners to improve economic self-sufficiency and reduce disparities. Lisa previously led Healthy Mothers, Healthy Babies, has conducted statewide health needs assessments for the Department of Health, and advocated for legislative policy on paid family leave, livable wages, childcare, gender equality, codification of the Affordable Care Act into state law, and the establishment of the Maternal Mortality Review Panel in Hawaii. Without further ado, I'm going to turn it over to Patrick.
Hi, good afternoon, everyone. Thank you for joining us. My name is Pat Bronco. I work here in the Department of Community Services. I was recently brought on to help administer some of these federal relief funds coming into the city and county of Honolulu. In May, we were very happy to launch with Mayor Caldwell the Household Hardship Relief Fund. And this relief fund is designed to directly give financial relief to those that live in the city and county of Honolulu. This fund is a $25 million fund, and it goes out to those who have experienced hardship due to COVID-19, whether that is, loss of work or as well increased expenses due to COVID-19, for example, childcare. And so the program is being administered through Aloha United Way and the Council for Native Hawaiian Advancement. And with the program, if you apply, you have to give, some supporting documents to show that you've lost your job or there's increased costs such as your rent, your mortgage, your utility bills, etc. And through the program, you can be able to receive up to $1,000 a month for rent, your mortgage or utilities, and then additionally $500 a month for childcare. And so far, we've had about 1,500 applications, and the first of the funds are now just being dispersed. So if you do apply and you do qualify, the vendors will be paid directly. So for example, if you need assistance with your mortgage, the Council for Native Hawaiian Advancement or Aloha United Way will pay the mortgage company directly. And so it's been a successful program. We're very excited to be working with Aloha United Way and the Council for Native Hawaiian Advancement, and we soon will be bringing on another partner, Helping Hands, who will help us to administer these funds. Mahalo.
Hi, everyone. I'm Lisa. As Patrick mentioned, this fund, since it launched, has had an incredible response, and I think partially it goes to show what the need is in our community, and the way that we're tracking and the way that we're processing and referring people to services primarily is through our 211 line. And for those who aren't familiar with 211, it's a statewide confidential resource helpline. And it's not, although you may hear it referred to from everywhere from the governor's office to legislators' emails and such, contrary to popular belief, it is not a government program and it's not government funded or any kind of mandate as such. It's actually a service of Aloha United Way, and interestingly enough, has been around since the late 90s. It used to be called Ask 2000 back in the day for anybody who was around and remembers that. But the important thing to know about it is that it is a resource that's available statewide. It has resources for individuals and families and households on all islands. The database itself actually has about 1,300 different organizations and agencies with a total of over 4,000 programs, resources, and services. So it's quite extensive. And the one caveat I always give is that we are only as good as the information we have, which is to say it's definitely a two-way street with all of our partners. And that means if you have programs, you have services, and as we know in this day and age with the rapidly changing environment that we're in, service hours have changed, the types of services that are provided have changed, the availability period of things that are out there has absolutely evolved. So our ask, first of all, to the community is to make sure that the things that you have that are available to provide relief and resources for the residents of the state, to please make sure that you're in touch with our 211 department to be able to continue to offer it in the most effective way. With that said, though, 211 in the past, historically, we would answer about 1,200 to 1,500 calls per month. Right now, we're answering more than 1,500 calls per week. So it suffice to say, we've had a total of a 6-fold increase since the start of COVID that has sustained. At the very beginning, we actually had a 1,000% increase in the number of calls. Initially, people were calling very much looking for support, resources, and information about COVID-19. People were worried about where to go for testing, how to get testing. There's a lot of confusion out there, especially when it first hit. And as everybody knows, when it hit us hard and very, very quickly. With that said, though, the economic impact has been enormous. And as we all know, we are at record unemployment. We don't know when the end will be in sight. This is going to be a very, very long-term recovery for us. And 211 is definitely on the front lines in terms of answering those calls and being able to provide resources and support to people. In the past, historically, we would have an average of about 1 to 2 referrals per caller. So meaning someone might call, they're looking for, let's just say, food assistance. Well, typically, we would be able to offer them that, as well as our specialists are trained to round out the conversation. So asking them questions about what their circumstances are. Perhaps they might also have needs for looking for unemployment. Perhaps they might have needs for healthcare. Perhaps they might be eligible for SNAP, and our specialists are actually trained to be able to fill out an application for them so they can get connected to SNAP, which some people don't know exists. And for anybody who doesn't know, it's the Supplemental Nutrition Assistance Program, or what some people sometimes refer to as food stamps. But with that said, we are seeing absolutely the impact of what COVID is doing to people and the impact of losing their jobs or having their hours reduced. The number of referrals has gone from 1 to 2 options per call to now most callers are getting an average of 4 to 5 resources. So once again, it underscores the incredible need that has increased, but it also underscores the need for us to keep those resources up to date, which is really our ask to the community. People are calling, looking for everything from food assistance, healthcare, government services, senior assistance, disability assistance, employment assistance, and the trends that we've seen. Historically, 30 to 40% of our calls that we actually get are in regard to in regards to shelter and housing. That has stayed the same. We're still seeing about a 30 to 40% average number of calls looking for that. But again, it's 6 times more people looking. So it goes to show the need and the desperation is huge for people. The fear of being evicted, although we have the eviction moratorium, what we hear in real time from our specialists is that people are still being threatened with eviction. Whether their landlords do or do not know, it doesn't seem to abate the problem. So it is massive and it is very, very real. The other spikes that we're seeing, though, are the spikes in people looking for healthcare assistance and also looking for government services. So assistance with completing their unemployment application, assistance with getting MedQuest or SNAP or TANF, and it just doesn't stop. So with that said, what Patrick mentioned was the Household Hardship Relief Fund, and that is being offered through the City and County of Honolulu, as mentioned to us, and as well as the Council for Native Hawaiian Advancement. This program has been, I would say, first of all, in such demand that it crashed our 211 service on the day that it launched. We had far more people calling than we had the ability to answer with our system. And with that said, it has created an enormous backlog of people that we have had to triple our staff just to be able to serve, as well as our partners in the community who were working with us on the CRUA program, which was the COVID rent and utility assistance program that Aloha United Way first launched back in March when COVID first hit. That program served about over 700 households. And with that said, those households that were served, once we ran out of funds for that program, and this program has been fortunate to be able to start, it didn't mean that the number of people looking for help went away. So as an extension of the fact that we have this enormous list of people still waiting originally to get into the CRUA program are now coming into this Household Hardship Relief Fund. So it continues to grow. And another thing that as kind of an extension of community resources and support and acknowledgement about the realities of what's happening in our state right now is the ALICE report. So when Stephanie introduced, she was mentioning ALICE, which for those who don't know is the Asset Limited, Income Constrained, Employed population. Roughly half of our state live in the ALICE threshold and below. These are folks that are working very hard, working sometimes multiple jobs, but have barely enough to break even every month, and are absolutely a paycheck or two away from serious financial hardship. The ALICE report first came out a few years ago, and in fact, our newest report is coming out next week. What the ALICE report has done is, first of all, kind of galvanize people around a common terminology, but it has also underscored major cracks and major vulnerabilities in our state and in our communities. The report has shown, first of all, that not only are half of our population extremely vulnerable, but the disproportionate number of low-wage jobs, the fact that those industries, such as tourism, are incredibly vulnerable to any kind of upset to our tourism numbers, also underscores the fact that, first of all, we already had a major shortage of childcare providers, which for working families is often the biggest expense aside from their rent or mortgage, along with food insecurity, which in this day and age really shouldn't be happening. But those problems are real, they exist, and everything that was predicted in the ALICE report prior to it being launched again this year has really underscored the incredible vulnerability that people are in. It talked about the fact that if we were to have some kind of major threat to the system, whether it would be a natural disaster or otherwise, that the ALICE population would be incredibly impacted. What we're seeing now is that is absolutely the truth. The industries that we know that are the most vulnerable, our service industries, our tourism industry, have been hugely impacted. First of all, what we're trying to do is connect those employers to 211 so that they know that this is a resource they can offer to their employees or former employees. But we're also trying to make sure that we understand the breadth and what's going to be necessary for recovery. We've been working with the Hawaii Data Collaborative to kind of predictive model what the new ALICE numbers would look like, because since COVID hit, we know it's a whole different world. What we're looking at now is probably a 35,000 household increase in the number of families that have moved into ALICE because of the loss of their jobs, the loss of their hours, the loss of their business. So it's huge, it's not stopping, and I think we all know this story. But to kind of wrap up what I have been talking about, just to let people know, first of all, that there is relief. So again, for those that are in incredible need right now and worried about how they're going to make their rent payment or make their mortgage payment, the Household Hardship Relief Fund is an incredible resource. And again, thanks to the City and County of Honolulu for being such great partners and helping us to roll it out and being so supportive. Along with that, the other program I was just going to mention as far as a resource for housing security is also being offered through Aloha United Way, provided by the Department of Hawaiian Homelands. DHHL is offering assistance for Native Hawaiians who are on the homestead waitlist, and it is offered to people throughout the state, no matter where they are, people who have suffered some type of financial hardship, similar to this other program. And it does help pay for people's rent up to 6 months or longer, depending on their circumstances. So it's definitely a way that we're going to keep people housed because the threat of homelessness is real, it is looming, it is predicted to increase by up to 40% over the next year. And we are trying to do the best that we can just to make sure that we can offset some of that coming disaster. So with that, thank you so much for giving me the chance to speak. I'm happy to share any other information.
Mahalo to Patrick and Lisa. As a reminder to the attendees, please feel free to put any questions that you have into the chat box or the question and answers box. Let's start with our first question we have. Can you share the eligibility requirements for individuals to apply for the Households Hardship Relief Fund? For those without internet access, how can they apply?
So I can definitely answer that. For first of all, as a good entry point, people can call 211 and AUW or one of our partner agencies can assist. Otherwise, they can call the Council for Native Hawaiian Advancement directly for assistance. And the requirements essentially are that they have to have suffered some type of financial hardship, whether it's loss of job or hours. They need to be suffering a decline in their income, so they cannot be making more now than they were prior to COVID. And it's open to those variety of categories. Patrick, do you want to add anything?
I was just gonna also those who have still have their employment but have increased expenses due to COVID. So, for example, childcare or even elder care or things like that. There are certain categories that we do look at.
Okay, next question is, there are a lot of evictions set for the end of the month, though through real estate. How can we help those in that situation?
That's a really great question. There is a letter that was just drafted that has been sent to the governor and to our state legislators, acknowledging several things, one of which is a recommendation for an extension on the moratorium, assistance for people with their mortgages. Honestly, there needs to be a lot more advocacy behind this area because of the vulnerability that people are in. Of course, it's a hardship on both sides of things. Even the homeowner cannot go so long without making their mortgage payments. But I think the common voice behind the response and what would be helpful is what's needed right now.
And just sorry, I'm going to chime in just to give some folks some background. By the end of the month, June 30th is when the eviction moratorium is up, because it actually coincides with the governor's emergency proclamations. And so that's the reason for the date as well.
The next question we have, is there a way to get a link to the last ALICE report?
UnitedForAlice.org/Hawaii, or just visit the AUW.org site. The ALICE report is up there. If you're at UnitedForAlice.org, again, just search for Hawaii, but it can show you what our previous numbers were. And as of next week, when we release the new one, of course, that'll be posted as well.
Okay. Next question is, are these programs available statewide? Is the fund only available for the city and county of Honolulu?
This particular fund, the Household Hardship Relief Fund, is only available for those who are within the city and county of Honolulu.
And the Department of Hawaii and Homeland's program that I mentioned is open to residents statewide. There are also a very limited number of funds that primarily come through the EFSP program, which is the Emergency Food and Shelter Program, which is federal money. There are a few other organizations that do have limited funds for that. So again, calling 211, if they are not eligible for one of these other programs or they live outside of City and County of Honolulu, then there are other options available. Limited, but they are there.
Next question is, currently the 211 flyers, web ads, TV commercials all say 211 is for info on COVID disease. Do you also plan to update it to say 211 is also for info on social services as well?
Some flyers, although well-meaning, are not actually published by us, and the reach for it has been, in some regards, an effort to get information out about COVID. And what our specialists are trained to do is to tease out the problem. So when somebody calls, they may have a question about COVID, but our specialists are trained to really get at the issue of why they're calling. If it's as simple as just finding a testing site or something, great. But if it's the fact that they have lost their job due to COVID or something like that, then again, there's a line of questioning that goes with it. But yeah, we've had more incredible volume and the most PR we could have ever dreamed of, but some of it is kind of well-intentioned outside of our control.
And also for the Individual Hardship Relief Fund, we have been running newspaper ads as well as social media campaigns to get the word out.
Next question we have is, are there limitations to applying for multiple of these relief sources? Can folks apply for multiple relief resources at once, or is there a restriction?
Let me jump in first just to talk about the individual relief plan, since there are, two organizations that are administering Aloha United Way and the Council for Native Hawaiian Advancement. For this one, you can't apply to both organizations. You can only apply to one organization to qualify for this. We actually have a mechanism that actually checks between the two. So if you are interested in applying for the Household Hardship Relief Fund, I recommend that you go to either organization and don't apply to both at the same time.
And with that said too, some of these other supplemental programs are non-exclusive and non-restrictive, but like Patrick said, for this particular program, only one point of entry.
Next question is, how are the federal funds, the $387 million, being distributed by the City and County of Honolulu?
I can talk briefly. So that money that came to the City and County of Honolulu, it's being actually used to start these various programs. So for like the Household Hardship Relief Fund, $25 million of that money that came from the federal government was set aside. Additionally, $25 million was set aside for the small business grant program as well. And then as well as through the Department of Community Services, we've been giving grants to other organizations that have been helping out in other ways. For example, youth homelessness due to COVID, domestic violence increase due to COVID, as well as those very large food distributions that you've been seeing across Oahu has been coming and been used. We've been using the money from the federal government to put on those. And yesterday I ran the numbers. Over 30,000 households were actually fed through that program, and over 1 million pounds of food was distributed.
Next question is, I am working with a young mother who did not get all she was entitled to in stimulus money. She has been meeting roadblocks. Could 211 be a place I could refer her?
Sure, absolutely. I just want to make very abundantly clear, though, that 211 will refer her to the appropriate resources, which in this case is probably the IRS. They don't have the ability to do case management. They don't have necessarily the ability to ask her for any identifying information outside of zip code and age. And so they would tell her where to go. So sometimes there can be a frustration in that when people are hitting roadblock after roadblock. Obviously, it's a bigger systemic issue. We do what we can, and we try to see if perhaps there's another avenue that hasn't been taken yet. But with that said, unfortunately, sometimes that's the limitation that exists.
Next question is, do you know if any money from the CARES Act can be used to help keep people in their homes? Paying several months' rent or mortgage for people would be far less expensive than having them become houseless.
I mean, I would say that is definitely what this particular program that we were talking about is designed to do. And absolutely right that once people have lost their house or their home, the problems and the expense of the problems and the compounding emotional, psychological health issues that come with that are far more expensive to solve. So absolutely agree. And again, the need for kind of a collective voice for advocacy around this issue and the support for the direction of funding to programs like this is an important policy issue to get behind.
Next question is there a sense of numbers of people who might have become homeless due to COVID-19? What's being done for these people?
We do know anecdotally, and we do know through our partner agencies that we work with through Aloha United Way, that there is reported, again, anecdotal increase in cases. With that said, the moratorium has absolutely helped to stave that off. The effort must continue, though, in order to keep people housed. There's not a really good answer to it yet because the data is not available. So again, I say anecdotal because we don't really have data to back it up. We just know that from what we hear on our calls and from what we hear from advocates that people are not necessarily aware or necessarily adhering, and they may not be working with courts on an eviction, but that doesn't mean that things aren't happening.
Next question is, does AUW have a report on the frequency of requested services from 211? If so, is the report disaggregated by any demographics?
So on the demographic question, the things that we collect, it's a confidential service and we respect people's privacies. So the only things that we collect are gender, age, and zip code. And so to that extent, we're able to segment out the data by those data sets. We also collect, in fact, if you can visit us online to see in real-time data. I'm blanking on the website name, but it'll come back to me in just a second. hi.211counts.org. And 211 Counts is a national website, but hi.211counts.org will show the Hawaii data for 211 in real time, and you can see what the requests are, and you can see you can zoom in to the zip code, and you can see the number of requests that came, and also by gender.
Next question is, will you be reporting any data on households benefiting from the fund? How are you ensuring that resources are distributed equitably and to those with greatest need?
So we do have mechanisms, so we make sure that we're keeping track of those who are applying. We do have safeguards in that sense. We are using a program that helps us to determine, to make sure that, for example, as I said earlier, people are not applying to both programs. The program is designed to help as much people as possible. I can tell you from today that there's a great need, but we still have room for more applicants as well. And so I ask you folks that are on the line, that are learning about this program, to please spread the word to your neighbors, other individuals, other organizations, and encourage them to apply. because this program is a very good program, and it is indeed designed to help as much possible. So for example, those who apply need to have, or the requirement is 100% annual medium income. So it's designed for a lot. The bar is very high for a lot of people to be able to apply and to qualify.
And we are keeping track on the AUW website as far as the funds that we have been dispersing. So as the HHRF fund begins to be dispersed, we'll tell you those numbers, but you can see for now the CRUA program, which again is the COVID-19 Rent Utility Assistance Program, which interestingly, we started with $1.25 million for that program. It was available statewide, and the number of referrals maxed out the available funds in about 3 weeks. So the demand is high.
Next question is, who is working on identifying which neighborhoods are experiencing the most COVID prevalence? Are these efforts able to match these neighborhoods to resources? Is the Hawaii Resilience Strategy involved?
From the information that I do know, we've been working with the Hawaii Data Collaborative in collecting, and they are working on aggregating a lot of this data, working with Department of Health numbers that they have. And we, prior to COVID, had a program designed in mind that was going to layer different sets of data to show where needs are, what types of needs they are, and the availability of resources to show what people have access to or not. Because of course we know, especially rural areas, neighbor islands, they do not have the same accessibility that we do on Oahu. However, that project, which was designed for, a large-scale, long-term project, absolutely got kind of derailed by all of the needs of COVID, and has kind of pivoted. The research is being conducted. So Hawaii Data Collaborative, though, is most definitely working on that. I don't know if Patrick has other resources.
So with our food distribution programs, all of the sites were along Central Oahu, Waipio Soccer Park, as well as Aloha Stadium. However, we do have other programs, though, outside of the urban core that we're working with, and to make sure that the food is being distributed. The other thing, though, through our programs, our Kupuna food program, for example, if you're a Kupuna living in Laie, we made sure that you would be getting adequate meals that would get you through the week. So that's also something that's very important to us. We're making sure that the programs are not just centralized to Central Oahu, but make sure that it's going out throughout the community and it's equitably distributed.
Next question is, given the number of applications received, are you anticipating that the threshold of the funds has been met? Is there a need to expand additional outreach?
I would say, I know that at least from AUW's perspective, the number of referrals that we have not yet maxed it out. And I think that anytime that referrals can be made to link people to services that they need them is always a good thing. Even if and when this is expanded, there is definitely an effort still behind making sure that resources are being provided.
And I'll just add, for the Household Hardship Relief Fund, sorry, it's such a mouthful, but we have not maxed out the resources, and we will be here at the city and county. We will make sure that the resources, as much as possible, are reaching the community. So again, I do ask those who are online to please share this information, and please refer those who you know. For me personally, anyone I meet that says immediately that, oh yeah, I've lost my job, I'm like, actually, you can call 211, and there's this great program. And so we are advertising in the paper, through social media. The mayor has spoken about it. Our director will be presenting to the city council today as much as possible. But really, this is a grassroots effort. So if you can help spread the word, I greatly appreciate that. Thank you.
Next question is there a projected endpoint date for those who have been approved and are receiving the monthly financial support from the Household Relief Fund?
So with the CARES Act, all of the money has to be spent by December 30th. And so with the program, It's actually, so if you applied in May, you would get $1,000 potentially in May, and you would get that up to 6 months. And so through the process, you would have to get recertified. And so that's basically the program is designed currently to go up to December. And I can also, one question we've been getting is, for example, say you are back on rent for April, and May you get the hardship relief fund. And so we will always try to max out that amount. So for example, if your rent is $800, I'll be honest, I don't know anyone who has $800 rent here in Hawaii. But if your rent's $800 and you apply, we will try to max out to that $1,000 to make sure that May's rent is paid for, and then $200 of April's rent is paid for too. So we're making sure as much as possible these funds are directly hitting the community.
Next question is, will the federal funds also provide assistance for other emergency relief? You mentioned healthcare coverage, but what about domestic violence support or childcare assistance?
So childcare assistance, with the Household Hardship Relief Fund, you can actually apply for additional $500 a month for childcare. So we do have that service. Additionally, through separate grants and separate programs, we are looking currently and should be launching soon programs that are helping with, and we have programs in childcare, we have programs in domestic violence, but we are now losing some of that federal money to then expand services in domestic violence, youth homelessness, childcare, mental illness services. There's a lot of things that we're looking at and we're looking to work at right now. So you will see an eventual rollout of new programs, but there are a lot of existing programs already.
Next question is, how can organizations serving individuals in need apply for the funds?
So organizations, am I understanding that are seeking the ability to provide these funds to clients, or as far as, well, I was going to answer from the perspective of those that are interested and able to refer clients to the existing funds. It's absolutely something that we encourage, and I don't think we could possibly say it enough how important it is to give people access in a timely way. And as far as the partners that are working with Aloha United Way, we have several that are community-based, that are experienced in providing similar rent and shelter programs. And so we've partnered with them, but I'll turn it back.
Next question we have is, are there any specific plans by the City and County of Honolulu to address predicted 40% increase of homelessness, low income or public housing, etc.?
So there are plans in place. I'm not right now. My field is COVID-19 and trying to respond to that. But this is something we are aware of, and we are also looking at programs to help with the second wave of COVID, because that will affect those who are homeless as well as other programs. So that is something we are looking into right now to make sure that we are prepared for that. But as far as specifics to other divisions, I don't have the background to speak on that.
Next question is, last I checked, Kahiao was not accepting apps. Can you tell us specifically for the outer islands what resources there are to help members pay mortgage or rent?
In addition to the program offered to clients or people that are on the Hawaiian homestead waitlist, I, off the top of my head, would not be able to tell you that information. Aloha United Way is based on Oahu, although 211 does serve clients statewide. The best way to find out would be to call 211 directly to get that information. Also, people can visit auw211.org and do a search for rent and shelter assistance programs via the website.
Next question is, if I have to isolate due to COVID-19 diagnosis, I have heard that you can arrange for food or medication to be delivered to my home if I do not have other resources. Is that true?
I'm personally not aware of such a resource. Again, kind of, not to sound like a broken record, but absolutely, by calling 211 to inquire about that. We have over 4,000 resources, and so many of them are brand new because of COVID. And once again, too, for anybody who themselves, their organization has rolled out any kind of new program like this or like anything else, please let us know.
And I'll just also reiterate what Lisa said was please call 211. Besides, I know in the news you always hear about our programs that are helping to feed Kupuna. We have many programs that just focus on food security as well, just for the general populace. And so connecting through 211 would be the best place to find resources.
Next question is, are plans being made to keep hurricane season in mind? I think in regards to the funds that are available, will they keep hurricane season in mind?
Absolutely, hurricane season is definitely something on your mind. I serve on like the emergency action group with the city and county, and I can report as of a month ago that is something very much on our mind, and we are doing our normal preparation as normal to prepare for hurricane season.
Next question is, I understand the moratorium on eviction and I understand lack of specific numbers of homeless. What is being done for these people? Is housing being sought for them? Are they being provided with money to pay for housing? How is homelessness being addressed for those impacted in this way?
Broadly speaking, it's not just a problem now in terms of getting our arms around it and in understanding the depth and the complexity of the problem and its various iterations. What we do know is through, again, there's no hard data yet, which is the challenging part. And it, I would say, is sort of a popular notion that people aren't being evicted right now because of the moratorium. But in fact, like I said, we do know that is happening. For us, in the reach that we as AUW have, we find this out primarily through our specialists for 211. They're getting the calls from people that are panicking, that, they have had the cops called on them to leave. And what we are doing in those situations, we're getting the calls, is providing information directly to them. The other avenue that we hear about this problem is through the partner agencies that we're working with for the HHRF fund. Similarly, they're letting us know that their clients are getting threatening letters, they're being asked to leave for non-payment. And so, the information is there, it is true and valid, and it can be a little bit of a fight, but having an advocate like an agency to stand up and be able to share that knowledge and that information rather than the tenant themselves can sometimes help. And so in the case of, again, if we have people directly, provide them the information. If we're working through an agency, again, also providing them the information to be able to make those calls, and it does make a difference. The problem's bigger than that, though, as we all know.
Next question is, what would be the best way to advocate for extending the statewide moratorium on evictions, perhaps beyond the lift of the governor's emergency proclamation? It's best to call or email the governor, state senators or representatives, an advocacy organization, some or all.
But I would definitely say some or all of those. Hawaii Appleseed right now is working really hard and in a very collective way on this issue. And I would highly advise anybody who's interested in becoming part of the effort to reach out to them. They're doing an absolutely fantastic job with it.
Next question is, are 211 call operators introduce mental health resources as possible resources for all who call, or do they only do so for those who specifically ask for mental health help?
It depends. If they have called specifically for it, obviously they're going to get serviced in that way. But because our specialists are trained to ask questions that are a little probing in nature, we have a very, very extensive training for our specialists. You don't just jump on the phones and start answering calls. It's actually about a 4-week training before they get to answer calls. And so in those situations, they may be clued into circumstances that are giving them some context for why or how someone might be having some mental health issues. And with that said, in the most sensitive way possible, approaching the subject and providing those resources. What we do know, once again, is that the number of services and the availability of services changes rapidly sometimes. And so for any organizations, any agencies, any new services that are out there, please make sure to reach out to 211 to let us know so that we can include it.
Next question is, perhaps I'm not seeing it, but can't find the hours of operations for calls to AUW 211. I know AUW 211 database search is 24/7.
From 7 a.m. to 10 p.m., 7 days a week.
And Lisa, you were muted for that, I think the first part of your answer. Could you repeat that one more time, please?
Yeah, sorry about that. We have extended our hours from 7 a.m. to 10 p.m., 7 days a week.
Thank you. Next, or I guess to add on to the last question, if you have an out-of-state phone number, will it still connect locally to 211?
It will depend. You may get routed to a 211. For example, if you have a San Diego phone number, you may get routed to the San Diego 211, but they will forward you to Hawaii.
Next question is, if the funds are federal, why are funds only limited to Oahu or Honolulu?
The funds actually, I don't know the exact calculation, but the funds were actually allocated to all the islands. So the city and county of Honolulu received a certain amount. The county, I think, of Hilo received a certain amount. As far as the programs that we're talking about today, specifically the hardship, the household hardship relief fund, these are programs that the city and county of Honolulu developed for their funds. So I am not sure the specifics of how the other funds are being spent at the various other counties.
Next question is, do you have any recommendations for spending the CARES Act money that the legislature has put aside into the rainy day fund?
As far as, there is a separation. We are here at the city and county, so we have ideas to what to do with our funds. As far as the legislature, I cannot comment on that, but so you folks know, there are actually specific categories that the federal CARES Act money has to reach. It has to go to programs that help with economic recovery, prepare for the second wave of COVID, and to help generally make sure that we have the proper medical care. And so in order for the state legislature to use those funds, they need to fall within those specific buckets.
I would say, although I cannot comment specifically on the rainy day funds and how it is being spent, I would say that once again, Hawaii Appleseed, along with a coalition of 30 plus or more organizations, has done a spectacular job with parsing out what the community needs are, ranging from economic education programs, the diversification of our economy, childcare, mental health, domestic violence, food, shelter, all of these categories of need. There have been, I would say there's been an incredible amount of very thoughtful input, and the plan of action, so to speak, exists, and it's really up to the folks in charge to take the lead with it.
So we have gotten to all the questions that we have received. So before I do my wrap up, I just wanted to see if you folks wanted to just leave the audience with any last minute thoughts.
Again, I'll be the squeaky wheel, is just saying, please spread the word about the Household Hardship Relief Fund. It's a great program. It's written to be as flexible as possible to make sure that we are able to help as many as possible. So please spread the word on that. And also, another clarification is you can apply through Aloha United Way or the Council for Native Hawaiian Advancement. You do not need to be Native Hawaiian in order to apply at the Council of Native Hawaiian Advancement. So I just want to make sure that you folks, when you're spreading the word, you can apply through either organization. And so mahalo for having me today. Thank you.
And I would just say also thank you for having me, and thank you for this opportunity. Again, for anybody who has clients or even your own organization or your own employees that may have questions and needs, 211 is absolutely the place to go. Please be patient and kind with them because the call volume is so extreme, and the emotional labor of this job really can't be understated. With that said, it's such a pleasure to be able to help. And I know there's probably a lot of nonprofit agencies on this call, but the other kind of parting thought that I'd like to say is now is the time in which we need to come together. We need to find where our collective resources are. We need to figure out ways that we can do things together in tandem, more cohesively, without the competition that sometimes can occur. With that said, too, those who are in a place to give and can give of financial resources, this is the time. I didn't talk about this at all today, but the thing that AUW sees amongst our partners is the organizations themselves that are providing life-preserving, life-changing resources and programs. They are often in very difficult financial situations themselves. Contracts are getting held up because things are not getting processed as quickly because people are not there to do it. Fundraisers cannot be held. People who may have pledged donations have since lost their jobs and are not in the same place to be able to give. And so the only possible way that we are going to get through this crisis and come out okay is by leaning on each other and generously supporting in our time, resources, and our financial capacity as best and as generously as we can.
Mahalo again to Lisa and Patrick for being our trainers today. As a reminder to those on the webinar, I know there were a lot of organizations and resources mentioned, and we will do our best to get all of those links to all of those in our Mahalo email that will be sent out to you folks later this afternoon. Again, mahalo to our trainers, mahalo to all of you for joining us on the webinar, mahalo to the HIPHI staff behind the scenes helping out with the webinar today. As a reminder, we are now hosting our webinars every other week. So our next one will be on Wednesday, June 24th from 1 to 2 p.m. and we will be discussing food security. So mahalo again for joining us, and we hope to see you on the 24th. Aloha.